and staffing problems were piling pressure on the service. The Scottish Government said staffing and spending were at record levels. Hugh Pym, BBC News.
Well, joining me now from our Westminster studio is Phil McCarvill, who's Deputy Director of Policy at NHS Confederation. We've heard, as Hugh was saying, warnings about the levels of pressure on the NHS before, but never from the GMC.
No, I think it's significant, the fact that the GMC has talked about signs of distress, and we've had recent reports from the Care Quality Commission which has similarly raised concerns about the pressures which are growing across the health and care system, send a real important signal to the whole of the health and care system that we have an issue here which needs to be addressed.
We've heard it many, many times before. We are constantly talking about an NHS under so much pressure. How would a break in that pressure, how would the pressure becoming way too much manifest itself?
I think what we've got at the moment is doctors, nurses and other health and care professionals are working really hard to make sure they're delivering the care, and I think this report underlines the fact that they are continuing to do so. But what we're not seeing is a commitment to address some of the pressures which are existent across the whole of the health and care system. We often tend to focus on what happens in the NHS, but what happens in the NHS is so dependent upon what happens in other parts of the health and care system. So we have pressures at the moment in terms of social care funding, and that is having a real impact in terms of the ability of hospitals to discharge people who are fit and well enough to go home, but don't have a care package which will enable them to do so.
Is it all about money?
I think it's about money across the whole of the system rather than in one part of it. I think in terms of the pressure at the moment is in relation to social care, and there's an opportunity for the government in the autumn statement, when it sets out its spending plans for the coming year, to actually address this particular issue. What happened in the previous spending plans was that funding for social care was pushed back to the latter end of the Parliament, whilst money for the NHS was up front at the start of the Parliament. And what we need to see is money coming forward, being brought forward, so that we can address the issues within social care and make sure that we have a sustainable settlement for social care.
The difficulty is any bright young student thinking about a career path is going to look at all these dire reports coming out of the NHS and frankly not want to go into it.
I don't think we have a shortage of people who want to go into the NHS. I think what we do have is pressures on people within the NHS, and I think what we need is support from the government and from other bodies to make sure that people are supported to deliver the best possible care. That means care in the NHS but also in social care, and if we can get that support right, then we create the conditions in which people can provide the right level of support and care that people need and want.
Phil McCarvill, thank you very much for joining us.
French officials say that all the inhabitants of the migrant camp in Calais, known as the Jungle, have been removed from the site.